afternoon, everyone. My name is Vishnu Mayapadai. I'm a dual certified family nurse practitioner and women's health nurse practitioner. I'm here with my supervising medical director, Dr. Ali Jafarian, who's a DO for more than 30 plus experience, and he runs a practice in Mesquite called North Texas Family Clinic. Today, we will be talking about breast cancer awareness. This is October month, and this month is known to be famous for bringing awareness for breast cancer. So since I have expert sitting right next to me, I will have him answer some questions that I have collected over last 1 week. So public who is watching us could benefit with those questions and answers. So Dr. Jafarian, first of all, I would like to thank you for giving your time and sharing your expertise with us. I would like to ask you, what is the number one advice you will give it to women out there to be aware about breast cancer?
Okay. Number one is know your body. Every female should start knowing their own body, examine their own self breast exam. We recommend usually once a month and repeat it the same day, usually every month. Know your family history. Most of the breast cancer have family history associated with them. And also your diet. Most important thing, what you eat can lead to not causing the breast cancer, but would speed up your, if you have any gene for it, usually it shows up more. So most of the studies show that obesity is one of the risk factor, and other risk factor is having no babies usually, and having your period early ages, and continue to have period in later age. So knowing these histories definitely is good to have a talk to your doctor or provider. Start about age 40, usually start getting routine mammogram, and if any of the mammograms are abnormal, you need to have sonogram to pursue that, make sure there is no abnormalities.
Thank you, Dr. J. Dr. J, there is a big talk on BRCA1 and BRCA2 genes that are found in female and male people. I wanted to know what percentage of BRCA1 and BRCA2 turn into breast cancer.
I don't have exact statistic, but definitely is one of the highest risk factor. And if one of the family member have one of these genes, you should be tested. But before you do the test, you have to consult a geneticist. And geneticist will see that your risk factor, and she or he recommend whether you are a candidate to get the testing, genetic testing or not.
Modification, diet and exercise, we can turn on and turn off the cancer gene. What is your opinion on that?
That's correct. Because the genes that you have usually have to be turned on or off, and usually that area of the genetic called epigenetic. So even you may have the seed for the cancer, the protein that turn that cancer on and off usually depends on many factors, but is influenced by environment and the food that we eat. So therefore, even if you have the gene, you could delay expression of that gene by changing your diet, usually healthy diet, and not having any refined food, fatty, greasy food, and high carbohydrate food. Usually the most cancer reducing food are vegetables and fruits that is not high in sugar. Usually is the best way to go.
Thank you, Dr. J. One last question that I wanted to ask you. Is there any role of a family member or healthcare provider that we could reinforce so we could prevent breast cancer in the public? As a family member, what they should do to bring the percentage of breast cancer, as a healthcare provider, what you can do to prevent the increase in breast cancer?
Yes, we need to avoid the stimulant that causes breast cancer, and that may increase obesity, type of food that we eat, stress. These are all may increase the risk. breast cancer.
Thank you, Dr. J. That was very informational for people who are out there. And on top of everything, I would say that it's very informational for myself also, because these were some questions that were raised by my patients. And confirming with you, I am very confident that I was able to give them right advice. Thank you once again for your time.
You're very welcome.